For couples that want to undergo in vitro fertilization, there's a few basic things that have to be done first. We need to look at sperm, so we need to do a semen analysis. We need to make sure the woman's ovaries can make eggs, and we want to make sure that the uterus can hold an embryo. We need to evaluate it. We don't need fallopian tubes for this procedure, but we need those three basic things. Once they have this out of the way and we know that they're a good candidate, then the woman goes through a process of stimulation of her ovary with fertility medication to make her ovary make more than one egg. To do one egg, take one egg out, it may or may not fertilize, and you've gone through this whole procedure for one egg. It makes more sense to have several eggs. In fact, we average 10 or 11 eggs. So once she's stimulated with this medication to a point where the follicles that contain the eggs are mature, we take the eggs out, a little needle through the back of the vagina with a lot of sedation so women don't feel anything, but there's no incisions, just a procedure. The guys give us a specimen of sperm that day, and we put the sperm and egg together and looking for fertilization the next day. 3 days after that, the fertilized eggs are transferred into the woman's uterus through the vagina, through the cervix. Feels like a pap smear. And the number of embryos we put in is dependent on the age of the woman. As a woman becomes older, it's harder to get pregnant. Each embryo is less likely to give us a baby, so we leverage a little bit. Women over 40, we may put 3 or 4 embryos in. Women under 35, we may only put in 1 or 2.